Good afternoon, everyone. It is 12:30, so we are going to go ahead and get started. We appreciate you all joining us. I'm going to move quickly through our introduction here because we have a lot of content to cover, great content. I want to make sure we get it all in as much as possible. We apologize in advance if we run a few minutes over today. We want to make sure we cover all the material and then give some time for questions. So if we run a few minutes over, pardon us in advance for that. You will notice that all your phones are muted. We will unmute them at the end of this session for questions. You can also find Alex in the participant list using the chat button at the top right-hand side of your screen and send your questions to me. I'll be monitoring off-site. This is my contact info. If you're having issues reaching me during the presentation, you can email me here at outreach@carillionclinic.org, or you can send, don't call this number. This is the office number that we're actually using for this webinar, but if you need to reach me during the presentation, you can use this, or after presentation. You can always email me at this email address for future ideas for topics or for feedback for how the presentation is going. So with that, I am going to let our speaker introduce herself and then jump into the presentation. So thank you all very much for joining us, and I'll talk to you again in 30 minutes.
Good afternoon. This is Brooks Michael. Today we're going to talk about what our teams are up to. We're going to look at current trends in education and adolescent health. I confirm that I have no relevant financial disclosures. A little bit about our objectives today. I'm going to tell you a little bit about my role as Adolescent Health Educator. We'll talk a lot about the Youth Risk Behavior Survey, and then we'll look at data specific to the Roanoke Valley and what our youth are up to. Then we'll have an overall look at adolescent health behaviors and local resources and opportunities for our teens. In my role as Adolescent Health Educator, I stay very busy out in the community. I'm real excited with what I get to do. I present about 100 health classes across the valley each year. These are anywhere from Salem, Roanoke City, Roanoke County, Franklin County. I'm all over the place. I do a lot of health education on various topics and many different locations and after-school programs. Each year, some of these are in locations within Roanoke Redevelopment and Housing Authority. I work with Big Brothers Big Sisters. It's really a wide variety of locations. And then I work very collaboratively in the community with key stakeholders regarding adolescent health. These are the memberships of the committees that I serve on. I've been with all of these committees for the last 6 to 8 years. Roanoke Area Youth Substance Abuse Coalition, which is RACAC. I sit on the Salem Prevention Planning Team. I'm a board member with Roanoke Prevention Alliance, Prevention Council of Roanoke County. I'm also a board member with New Horizons Healthcare. I'm a member of the Healthy Roanoke Valley Wellness Action Team, and then I also sit on the Roanoke City Schools Advisory Board. So I try really hard to work with all those organizations that are doing things to keep our youth healthy. As you're probably aware, our adolescent age is a very big time for risky behaviors. We're going to look at a lot of those trends today. The Center for Disease Control lists the following as some of the top risk behaviors among teens. These are unintentional injuries and violence, sexual behavior, alcohol, tobacco, and drug use, unhealthy dietary behaviors, and inadequate physical activity. So today we're going to talk about the Youth Risk Behavior Survey, also known as the YRBS. First, I want you to know that this comes from the Center for Disease Control. They do the survey nationally. We also do it locally. It's given in Roanoke City and Salem City. It's also given in Roanoke County, Botetourt, and Craig County. The surveys are given in the 6th, 8th, 10th, and 12th grades, and they're given every other year to allow for trend data. This is a really comprehensive survey. There's about 130 questions. We ask everything from drug use to how many vegetables these kids are eating. We really try to get a big look at their health habits. We send our results to Virginia Tech, and they analyze everything for us. We have a lot of different ways that we're able to weed out the inaccurate surveys. Our region here in the Roanoke Valley, we are looked to by the state level as a leader. We have awesome data here. The surveys in all of our locations, the first 70 to 75 questions are exactly the same, and then each location will ask questions specific to what's happening with their youth. So we're going to look at some charts and go over what's happening with our kids. And I just want to mention that today we're going to look at 2015 data. Like I said, the survey is given every other year. So the survey is actually being implemented after spring break. When the schools get back in a few weeks, all of them will take the survey again. So we'll then have 2017 survey data to look at. But for right now, we'll look at 2015, and then maybe I'll be back at some point to let you know what's changed in the last couple years. So let's start with tobacco use. And just to point out, this data I'm sharing with you right now, this is the valley. So this is a combination of Roanoke City, Salem, Botetourt, and Craig. We're able to give you specifics for each location, but I wanted you to have a picture of what's happening all over the valley. First, we asked, have you ever tried cigarettes? You can see in middle school, 6th and 8th graders, that was about 13% across the valley. In high school, that is almost 37% compared to the national number, which is 32%. And the national number is always going to be high school. So you're looking at comparing high school. So in the Roanoke Valley, there's more kids, for example, that have tried cigarettes in high school than across the nation. We asked, is there moderate or great risk if you're smoking daily? Almost 90% of middle school and 88% of high school kids perceive it to be risky, so that's good. We asked about cigarette use in the last 30 days. Only 3.6% of our middle school compared to 15% in high school reported using tobacco in the last 30 days. Tobacco is easy to get, so we want to find out how easy is it for them to get cigarettes if they want to get it. In Roanoke Valley for high school, that was about 78.5% said it would be very easy or fairly easy to get tobacco. That's about 37% for middle school that said it would be fairly easy or very easy. When you look at trends over the years, I'm showing you here 2009, 2013, and 2015. This is what I wish we would see in all of our risk areas because cigarette use was at 50% in 2009. These are high schoolers. That is down to 36.9% in 2015. That's the goal. We asked about smoking a cigarette in the last 30 days. That's gone from 20.6% to 15%. And then reported it's very easy or fairly easy to get. That has gone down from 86% just about to 78.5%. Now let's talk a little bit about alcohol. We asked, have you ever had a drink of alcohol? In middle school, that's 22%. In high school, that's 61.3%. Nationally, that's 63%. We asked if you drank alcohol in the last 30 days. 8.5% for middle school, 35.9% for high school, compared to 32.8% nationally. And then our last question is about binge drinking, which is defined as 5 or more drinks in a row for a boy or 4 or more drinks in a row for a girl. So we asked, did you have 5+ drinks once or more? That was 5.8% in middle school, 21.7% in high school, compared to the national of 17.7%. How easy is it for them to get alcohol? About 76% of high school students think it's easy, compared to 41.7% of middle school said it would be easy or fairly easy. Here are our trend numbers. First one is binge drinking, 5 or more drinks in a row. In 2009, that was about 25%. That's gone down. That's good. Ever had a drink of alcohol? That is 67% about 5 or 6 years ago, down to 61%. And then alcohol use in the last 30 days has fluctuated some, and most recently it's at 35.9%. Okay, so we're going to move on to marijuana. These questions are very similar. Have you ever used marijuana? That was 11.4% in middle school, 43.8% in high school, compared to 38.6% nationally. So you can see we're higher here than across the nation. This is a question that I want to pay particular attention to. Students reporting that there's great risk or moderate risk of using marijuana. That was 73% in high school, only 41.3%. I mean, that was 73% in middle school, excuse me. Only 41.3% in high school report moderate to great risk of smoking marijuana. Marijuana use in the last 30 days, that's 7.5% for middle school. About a quarter of them for high school have used marijuana in the last 30 days. How easy is it for them to get marijuana? Again, that's about 22.8% for middle school youth reporting that it's easy. And then almost 70% of high school youth report that it would be easy or fairly easy to get marijuana if they wanted it. There's a lot of mixed messages through our media and just what's happening across the nation with the legalization of marijuana, and I think our youth have some mixed messages that they're getting about marijuana use. So when we look at the trends, here is, have you ever used marijuana? We're at 42% in 2009. That's still pretty similar, 43.8% most recently in 2015. Marijuana use in the last 30 days has remained pretty consistent across the board at 24%. And this is where I see concern reporting the risk that comes along with using marijuana. That number continues to go down. In 2009, almost 60% of our kids thought that this was risky and not good. That's down to 41%. I will be really curious to see what those numbers look like in 2017, this year. This question was new on our survey in 2015. We add things to these surveys based on trends and what's happening, and vaping was something big that's come along, so we did ask about this. 45% of Roanoke Valley High School students report that they've used an electronic vapor product. That's about half of our teens reporting they've ever used a vapor product. And then 27.3% of our students report they've used an electronic vapor product in the last 30 days. We ask about if they've ever used it in the last 30 days because we're trying to figure out if this is something they're doing pretty regularly. Have they done this in the last month? Let's just look at some other drug use. Just wanted to give you a quick overview with this. Cocaine use for middle school, that was 3.9%. High school is 10.3% compared to the national of 5.2%, so a lot more, twice the amount of cocaine use here than across the nation. Methamphetamines, that was 8.9% here compared to 3% nationally. Heroin use. I am sure you have seen in the news all the problems we're having locally and across the state of Virginia in regards to opioids and heroin use. This is a really big problem right now for our kids, and I'm really curious to see our numbers in 2017. But in 2015, you had 7.3% of high school students reporting using heroin compared to only 2.1% nationally, and then ecstasy was 11.2% compared to 5% nationally. Prescription pills, a lot of times, most of the time, this is what actually leads to our heroin use. The kids are using prescription pills. They no longer can get the pills, and they turn to heroin. We asked if they've ever taken prescription pills to get high. In middle school, that was about 5%, almost 14% in high school. We asked about their 30-day use. That was 6% in middle school compared to 14% in high school. And then we asked how easy was it for them to get pills. That was 38% in the middle school, 54% in high school. And most often when we ask where they're getting their pills, it's from home. It's from parents and their medicine cabinets. And in April, they're having a very big drug take-back, so there'll be sites all over the valley where you can drop off expired or unused prescription medications to help combat this issue. All right, let's talk about sex for a minute. These numbers, just so you know, when we ask in the middle school, we're not allowed to ask 6th graders. So the middle school numbers are only going to be your 8th graders. We asked the question, have you ever had sex? Across the valley, that was 19.5% in middle school. In high school, that was 50% compared to 41% nationally. We asked, have they had sex before age 13? That was almost 12%. And then 7.7% in high school compared to 3.9% nationally. We asked about students who have been pregnant or gotten someone pregnant. We don't ask that in middle school. In high school, that was 8.3%. They don't ask that nationally. And then we asked about condom use. That's 57.7% in 8th grade, 55% in high school compared to 59% nationally. So I need to let you know that these next couple of slides refer to Roanoke City specifically. I pulled these numbers out for you because there's been such high teen pregnancy in Roanoke City, and I wanted you to see what it looks like with our students here in the city. So we asked if you've ever had sex, and I'm giving you trend data here. It's been about 58% for the last several surveys compared to 41% nationally. We asked about sexual intercourse before age 13, and that's run, about 11.9% compared to 3.9% nationally. 4 or more partners, we ask about this. Luckily, this has gone down. You can see in 2011 that was almost 24%. It's down to 15.6% compared to 11.5% nationally. And then we ask about sexual intercourse during the last 3 months. Most recently, that was at 39% compared to 30% nationally. These are our Roanoke City high schoolers. These are our Roanoke City middle schoolers. These are our 8th graders in Roanoke City. We asked, have you ever had sex? In 2011, that was 31.5%. I don't have it here in the chart, but I know that in 2009, that number was up to about 36%. That was well over 1 in 3 of our 8th graders saying they've had sex before. In 2013, that's 31%, and then most recently, that's 23.8%. I do a lot of education about family life in the high schools in Roanoke City, and I've been working in 10th grade health classes for the last 7 or 8 years. This year, I'm now in 8th grade classes. I'm very happy about that. We're doing a lot of education with the 8th graders. We asked, have you had sex before age 13? That was 20% in 2011. That's down to 16% in 2015, and then 4 or more partners. You can see these numbers here. We're down, and that's good. Okay, let's talk about teen pregnancy just for a minute. Roanoke City at one time had the highest teen pregnancy rate in the whole entire state of Virginia. That was in 1993. There's 130 cities and counties, and we've always been in the top 5. We have a lot of teen pregnancy in Roanoke City. You can see in the last several years, 2012, 2013, and 2014, we moved out of the top 10. This is a huge accomplishment. We do a lot of education about this topic, and so we've been really pleased to see us out of the top 10. However, the most recent data, which is 2015, and this data comes from the Department of Health, Roanoke City is now, again, the 5th highest in the state. But overall, all the rates are lower now than they were 10 years ago, not just locally, but nationally. Here's a chart that just kind of gives you what things look like over the last several years. You can see this with our rate in 1993, 71.8. Our most recent rate is 31.8. So even though we're still in the top 5, we're doing much better. Our rates are much lower. Let's talk about STDs just for a minute. This is a serious health issue, and STDs are very common among teens. Teens ages 15 to 19 are at the greatest risk for getting an STD, more risk than any other age group. There's a lot of misconceptions about our youth about STDs and sexual activity, and we know they're much easier to prevent than they are to treat. Here's a look at the rates. This again comes from the Department of Health, and this is 2015 data. It's the most recent that we have. For chlamydia, this is per 100,000 teens. Our rate was 3,519. The state of Virginia rate is 1,640. So for chlamydia, we are twice the state of Virginia rate. We used to be 3 times the Virginia state rate. That was about 3 years ago. For gonorrhea, our rate is 952 compared to the state of Virginia at 298, so we're much higher in gonorrhea also. We've partnered with Roanoke City Schools and done a lot of education with parents over the years, trying to teach parents and youth about the dangers and how to prevent STDs. I also want to talk about mental health. These are some questions that are really trying to get an idea of how our students are doing. They're under so much pressure these days. So first we asked, did you seriously consider attempting suicide in the past 12 months? I think these numbers are really high. In Roanoke Valley in high school, that was 18.5% compared to 17.7% nationally. Then we asked, did you actually attempt suicide in the last 12 months? That was 12.5% here compared to 8.6% nationally. We also asked the question, did you feel so sad or hopeless almost every day for 2 weeks or more in a row that you stopped doing some of your usual activities? That was 1/3 of our students in high school in the Roanoke Valley, and that question is actually not asked nationally. I pulled out Roanoke City numbers again with mental health. I wanted to show you, there is concern here, and we're trying to do a lot with counseling and whatnot to help our students. We asked, did you make a plan on how you would attempt suicide in the past 12 months? In Roanoke City in high school, that was 23% compared to 14.6% nationally. We asked, did you actually attempt suicide in the last 12 months? 16% here, 8.5% nationally. Then we ask another step further, did you actually attempt suicide in the last 12 months that resulted in treatment by a nurse or a doctor? That was 8.2% here compared to 2.8% nationally. As we're getting near the end of our webinar, I just want to go over a couple quick teen health habits just overall. Okay, so how many hours a night are teens of sleep are teens supposed to get? Well, they're supposed to get 8 to 9 hours. How many hours do they actually get? They actually get about 6.5 hours per night. I'm in front of thousands of kids in the classroom, and they will all admit to me that they're not sleeping enough, and most of the time it's because of their phone. Teens are the highest risk age group for not getting enough sleep, and kids that don't get enough sleep are at risk for lots of things. These include mood problems, depression, memory and learning difficulties, and poor grades. When we think about social media, we do a lot of work with parents and youth doing education about social media. While it's wonderful to have all this technology, it does affect our health in many areas. These include sleep or lack of, which I just showed, and then exercise or lack of. We're worried about our kids being too sedentary. This can really affect their self-esteem, especially the girls with Instagram and how many hearts they get. There's a lot of things on social media that affect their self-esteem, their body image. And then it really, communication skills are so important. And we're seeing a lot of kids that don't really know how to have those face-to-face conversations. They do it all through text and group chat. So we need to bring back some of those skills. With our preteens, those going into middle school, the 3 most common things that they will experience online during middle school, these include gossip, bullying, and inappropriate messages. We do a lot of education with parents about what to expect when their kids are heading into middle school. Here are some of the top apps among teens. I could do pages and pages and a whole presentation just about this, but I just pulled out some of the top chats. Snapchat's at the very top. Instagram, Kick Messenger, WhatsApp, Musical.ly, and then they do a lot of live streaming now with YouNow and Watch Live Video. Most often, teens send sex. This is about sexting and inappropriate images to which of the following? This is one of my questions I ask in the classroom. Is it to strangers, friends, or boyfriend and girlfriend? Most often, they're sending their sex to boyfriend and girlfriends, and then 25% of people who receive these messages share them with at least 3 other people. We are raising a generation of multitaskers. It's great to multitask, but then sometimes you need to really just focus on one thing at one time. While doing their homework, more than half of teens admit that they're using social media and watching TV. 60% report that they're texting during their homework, and 3/4 of them are listening to music. So we're wrapping up. I just wanted to tell you a little bit about our Adolescent Student Health Services. This is where I work with Carilion. We are so lucky to have these clinics. I'm so excited that we can offer this to our kids. Our goal is to help young adults stay healthy now and in the future. We have a Facebook page. Please like us on Facebook. We put a lot of really good information out there. These are our locations. So we have a student health center, different than the school nurse. We have a full doctor's office inside William Fleming and Patrick Henry High School. These are open every other day. You can see here our hours. And then we also have our main clinic on Jefferson Street. Our clinic on Jefferson Street, we serve kids there from all over the valley and beyond, and we're open all through the summer, all year long. In the state of Virginia, there's only 2 other high schools that have full doctor's offices inside their schools, and those are in Martinsville and Alexandria. We have 2 right here in Roanoke City, so this is awesome for our kids. This is what we do. It's comprehensive health, well visits, physicals, immunizations. We do diagnosis and treatment of STDs, family planning, contraception. We also have mental health counseling. I just shared with y'all mental health data on our youth. So we keep our mental health counselor very busy at our clinics. Resources for teens. There's a lot of great things in the Valley for teens. There's our 3 teen health centers. There's youth leadership opportunities and provision clubs in a lot of the schools around the Valley. And I post about a lot of this on Facebook. There's a lot of curriculum-based programs out there, like the Teen Outreach Program, and then there's a lot of other after-school programs in a lot of different settings. So there's a lot here for our teens to help keep them on the right track to adulthood. Okay, I think I've covered a lot of information in a very short amount of time. Thank you.
Okay, thank you, Brooks. Leave your headset on there. Let's scoot the phone here a little bit closer to me. I will unmute the phones here really fast. I know that was a ton of information to cover, and we essentially barely even scratched the surface on all of these. And we'll definitely have Brooks come back and maybe do a deeper dive into some of these different sessions. I've got some questions already, but I want to go ahead and open it up to see if anyone on the line has a question first. We've got about 5 minutes left.
The conference is now in talk mode.
Okay, if you are on the line, if you would just go ahead and mute your phone unless you have a question for us. But now's your chance. If you do have a question, keep your phone unmuted and ask away. Somebody panicked and hung up. Okay. I've got a couple questions here for you, Brooks, and if you can't answer them, if not, it's okay, we can move on to the next one. As you're going through all of these survey responses, the question I come up with is, how accurate do we think this data is? And I'm sure that's been asked before. Are the kids saying they're doing this just because they feel like that's what people want to hear, or they want to be cool, or they want to seem more risky or more dangerous or something like that? So how do the survey creators address that, and how do you think it is reflected in the result?
So that's a great question. I usually address this in all my presentations because we get this question a lot. First of all, any of the surveys that come back with any kind of nice pictures or Christmas trees drawn on them, those get thrown. And then we have questions on some of our surveys that ask about a certain drug. Have you ever used the drug such and such? And it's a made-up name that doesn't even exist. And so if our kids answer, yes, I've used this drug, we know they're probably lying, so we toss those surveys out. The survey is anonymous, so their name is not on it. And then our researchers at Virginia Tech do a great job of helping us analyze the data. If you look at the numbers from every other year, they're so similar that we don't think our kids can remember how they lied 2 years ago to lie again, 2 years later. So we get rid of anything suspicious. We ask those placebo questions to help weed out even more, and then we drill down our data.
Perfect. Okay. My next questions are about, we've covered a lot here with kind of Roanoke County, Roanoke City. If there's someone listening from outside that footprint, and I know you put other, I remember Craig County was in there, Salem's in there. There's a lot of counties in that. If someone's listening from either more northern, more southern, let's say closer to West Virginia or down toward North Carolina, Danville, Martinsville, Lynchburg, any of those areas, how would they go about getting the results for their areas? Can they go online and find them, or do you have to go through a health coordinator? How would people find those results?
So this survey is not automatically given in every jurisdiction. So they may not, I know where they give it here in the Valley. It isn't given nationally, but they would need to find out, first of all, if the survey is being given, and if it is, who's administering it, and they should have the data. Now, if they've never given this survey before, we can help them figure out how to get sample surveys and start that process. There's a lot of work that goes behind it. You got to have the schools on board. That's the best place to get the students and to do the survey. So through partnerships with the schools, we've been able to make that happen.
Perfect. Okay, I think we've got about a minute left here, so we'll do, I think I could talk about this all day long, and as someone who has small children coming up, I'm slightly terrified, but we'll definitely have Brooks back to talk about what we're doing. I'd love for us to start addressing kind of what are we doing in kind of our region, maybe even beyond Roanoke, for the substance abuse issues and stuff like that, because I feel like that is a major topic that everyone is talking about across our region. So we'll definitely have you back to discuss some stuff like that. We also have a lot of this being discussed at our upcoming pediatric conference that's happening on December 1st this year at the Hotel Roanoke. You'll see more about that if you participate in any of our emails, or if you're part of our outreach network, you can get more info about that. So here's your contact information on the screen. If you want to run through it real fast for anybody, I'll put you back on here.
Sure. Hi, this is Brooks Michael, and so there is my phone number. That's my office phone. I'm not there all the time, but if you needed me urgently, my cell phone number is also on the voicemail at my office phone, and then there's my email. I check that all the time. So if you have any questions, if I can help you in any way, or you need something more specific, let me know. I'm happy to help the best I can.
Perfect. Okay, so that wraps up our content. Again, we try to fit this into 30 minutes. It's bite-sized so that you can participate in it over your lunch break. It's very boiled down, so hopefully you appreciate that content. If you're looking for longer format education, you can always participate in our grand rounds, which we do every Thursday from 7:30 to 8:30. If you're listening and you want to do your survey for your CME credit, if you're listening live, if you go to the calendar appointment that you use to log into this, or the email, there's a little tab that says CME credit. Click that survey, answer those few questions, and that information automatically gets dumped into our CME tracker system. You can go to our CME webpage online and find that. That's just carillionclinic.org/continuing-medical-education. And you can log into your CME tracker and see how many CME credits you've had through Carilion. If you're listening to this as a recording, you can follow the link under the Show Me More in the video section, show more notes in the videos information section, and go to the same CME tracker system. This does qualify for 0.5 hours of Category 1 AMA PRA credit. So with that, we are just 1 minute past. We did much better than I thought we were going to do. Thank you, Brooks, very much for getting through that. If you all have any information or any questions or would like to contact us, you can always email me at outreach@carillionclinic.org, and I'd be happy to get any additional questions or make any connections with Brooks that you would need. With that, we're going to go ahead and disconnect the phone lines now. Thank you all very much for joining us.